What is it that patients having varicose veins should understand? Varicose veins, piles, varicocele, etc. develop as a result of the veins, which are blood vessels which return blood to the heart after collecting metabolic waste, are subject to excessive pressure, and the walls and valves of these blood vessels suffer damage. When pressure makes such veins get dilated in the legs, it is known as varicose veins. When this happens in the anus, it is called piles, and when it develops in the scrotum, it is called varicocele. In modern medicine, surgery and procedures focus on shrinking or removing the veins to reduce the difficulties associated with the stagnation of blood in these vessels. Destroying blood vessels as a part of the treatment can cause undesirable side effects. When veins are removed or using lasers, chemicals, etc. to shrink and reduce the enlarged vein, the flow of blood can be compromised. This is the reason why, in spite of treatment with sclerotherapy, laser surgery, glue therapy, stripping, etc., very often discoloration, discomforts, edema, ulcers and bleeding develop again. Is it not possible to repair and strengthen the damaged blood vessels, improve the blood circulation and reduce discomfort by providing nutrition and improving circulation? What is needed to achieve this? Let us learn how lifestyle modulation helps to strengthen our immunity, the self-healing power of our body to overcome such disease conditions. Health tips are not the focus here. Rather, the effort is on providing information that will help you to understand the causative factors behind the disease, measures for early detection, investigations to assess the impact of disease on different parts of the body, available treatment options in modern medicine with their benefits and limitations. The goal is to help you understand the relationship between the disease and the lifestyle factors. More importantly, to understand the impact of lifestyle correction on reversing the disease process and preventing recurrence. Those who are on medication should remember to reduce or stop medicines only under medical supervision. When you try to understand about the varicose veins or the piles or varicocele affecting the blood vessels of the body, we should have a basic understanding about how our blood vessels and heart and the circulation is functioning. We know that there is a heart which is pumping the oxygenated blood coming from the lungs to the whole body, and this blood is the deoxygenated blood is collected by the veins, and it is brought to the heart again, to the right side of the heart, and it is sent to the lungs and again oxygenated and come back to the left side of the heart or left ventricle. Left atrium and ventricle is receiving this oxygenated blood and it is again pumped into the body. But for the return of the blood, there is no pumping system. The heart, there is no heart in all over the body. But what is facilitating the return of the blood actually? It is facilitated by the muscular action, especially in the lower leg. It has to pump up to the heart. So for that, the calf muscles are acting as the pump. So it's generally called heart. The calf muscles are called the second heart actually, or we can say second and third two are there. And it is not only the calf and the thigh muscles, and almost all the muscles in the body is taking part in the returning of this deoxygenated and the blood with collected the metabolic waste. And it is again pumped into for the metabolic waste has to go to the liver and also to the kidney for waste removal. And when we come to this physiological aspect, why this is happening? In the leg and the anus and the scrotum, these blood vessels become prominent and getting disease when the vein is affected. That is mainly because of the gravitational pulling. Gravity, that Earth's gravity is, there is always a pulling effect is there, and only with the muscle activity, it is coming up. Because of the pulling activity is happening more in the extremities, the leg, anus and the scrotum, this part is more evidently affected. Actually, this blood vessel damage, this if there is a varicose vein or varicose vein or this piles, it is actually all over the body the veins is affected, but only this part is showing the symptoms. And even the breathing movements have an important impact on this return of the blood to the heart. When you are holding the breath or the lung is filled, the blood flow to the heart will be reduced. When the lungs is empty with the expiration, the flow to the heart will be increased. When we come to the biochemical aspect, what is the problem with this pooling of the blood or the varicose vein and the circulation is not taking place normally? Then the toxins will accumulate in that area and the cell get damaged. If it is in the leg, it is accumulated, you get that darkening or the varicose veins will be prominent and although the skin get damaged. And definitely the blood vessel and the whole part of the lower limb get affected. If it is the piles or the anus is affected, the anal cushion will be affected, the cells in that area will be affected. And even in the scrotum, if the problem is comes, it is mainly affecting the fertility. Actually, in the scrotum, there is testicles are there and they are producing the sperms. If the varicose veins are there, the flow of the testis is not correct, the accumulation of the toxins and oxidative reagents and other things will damage the sperms itself. That sperm will get a DNA damage to the sperm is one of the reasons for the infertility related problems with this varicose vein. Next, what are the symptoms? What is the symptoms which is? It depends on the part of the vein which is affected. If it is in the leg, it will be the darkening of the leg, itching, edema and ulcer formation, and even the blood vessels become thin and dilated and it may rupture with the increase in the pressure. And even the fibrosis can, because of the chronic inflammation, the legs and the ankle get fibrosed and the movement will be getting restricted. And when if it is in the anal, the piles are like pain, edema, itching, that also can happen in that area also, and also the bleeding. And the same thing can happen in the scrotum also. And I have seen patients complaining of even the bleeding. I had never thought of that. I thought only the leg and the anus will be, but there are people who can get small bleeding episodes with the scrotal blood vessels also. And itching and discomfort and sagging, pain, sort of things are also very common. Next is how yet can we diagnose it? This, whether your blood vessels are damaged and what is the extent of damage. By the physical examination, doctors can make out some extent what are the problem. But nowadays the ultrasound scan and Doppler studies is so common. And we use the ultrasound scan to see and the Doppler studies to see how much damage is taking place, especially for the leg and the scrotal vessels. For the piles, it is the endoscopy is needed, that is proctoscopy, or now the flexible endoscopy is there. We can see what is internal piles or external piles, what is the extent, all those things we can find out by the endoscopy. The other thing, how much only superficial veins only affected or how much deep vein is affected, how many valves are affected, all this we can find out with the Doppler studies. Next, what is the real reason for this? Why this is happening? Everyone, when they get a disease, will definitely ask why it is. If it is a common cold, we can say it is viral infection. Or if it is an infection, we can say it's, but what is the reason for this varicose vein? It is basically because of the venous stagnation and resulting venous hypertension. Hypertension, we always think of the hypertension saying it is an arterial hypertension. 130, 90 or 140, 100, all these things are about the arterial hypertension we are talking about. This venous pressure increase when if there is a stagnation of the blood or there is valvular damage or the blood vessels are damaged and dilated, the pressure inside the veins also will increase. So this will increase because of the pressure, the valves, in the artery there is no valve because it is heart is pumping it, is free flow is there. But in the vein it has to come up. So if, and also this muscular movements of the leg or the other part of the body is actually helping this pumping up. So it will be intermittent. So there is valves to prevent the retrograde flow of the blood. So these valves are very effectively guarding, actually, just like the cardiac valves, the heart we have, mitral valve, tricuspid valve, or everyone must be aware of the valves in the heart. Just like that, there are multiple valves in the veins also. So this will prevent retrograde flow. So even if the blood vessel is damaged, dilated, and this valves are damaged, then the flow will be, retrograde flow will be there. That is the main reason for this the problem with the stagnation of the blood, and the symptoms develops because of that. And in why it is damaging, actually, this blood vessel is made of special type of protein and called collagen. That is mainly collagen and elastin is there. See, when the collagen or elastin or the protein which is made for this, used for this building of the blood vessels, when it is damaged, the blood vessel also get damaged. And it is the latest understanding about this damage is also this one amino acid called homocysteine. It's a needed amino acid. It's not a problem thing. But when there is certain vitamins or minerals, vitamins, especially folic acid, B12, B6, etc., is deficient. If there is a deficiency in the nutrition, this homocysteine, one of the amino acids, will get increased. And this is actually acting as a corrosive for the blood vessels, actually. That is, this homocysteine is considered as blood vessel damage marker. And many of the people will be knowing that the homocysteine level is high, the heart attack possibility is high. And I have also seen that many patients with this vascular damage, like varicose veins, have this homocysteine level is high. That is the cardiac marker. And that means that the damage is happening not only in the leg or the anus. It is throughout the body. Even the veins of the heart is also getting affected. So the chance of heart attack also will be getting increased. And we should understand another thing. This veins and the arteries are also made of the same material. For the connective tissue is needed for both. If one is damaged, the other is also get damaged. Only thing this artery has a more muscular wall. But there is also collagen and elastin is there in the artery also. But the veins are not that muscular. It is so dilated. The dilatation happens very easily. The latest understanding about this varicose vein also shows that this is when the piles and the vascular venous damage because of an autoimmune process, actually. Next, when we come to what are the predisposing factors, or what type of patients get this sort of problems? It's one of the major predisposing factors, obesity, and abdominal obesity especially. Even the ladies, when they are pregnant, the chance of increasing the size of the tummy. That most of the ladies, the first time it is a varicose vein or the piles appears during pregnancy, and it will, after that delivery, it may subside. But after later stage, when they get abdominal obesity, where the weight is increased, it will recur. Then another predisposing factor is a nutritional deficiency. And many, like this folic acid, vitamin B12, B6, and which will increase the homocysteine, and it is in fact acting as a corrosive for the blood vessels. Then is the sedentary lifestyle. Sedentary lifestyle means it's actually the blood vessels, which is the blood is in the venous blood is pumped because of the activity of the muscles, skeletal muscles. So if there is not activity and you are standing for a long time, then the pressure will be increased and varicose veins can develop. Another reason for this varicose veins to develop is weight lifting. If the person is lifting the weight with the wrong breathing pattern, it may, or just like if you are holding the breath and lifting the weight, it will increase the intrathoracic and intra-abdominal pressure, and the flow into the heart will be blocked. So that will increase the pressure, and if it can, because of the increased blood pressure, it can damage the valves. That is the reason many these weight lifters and all get this varicose veins. And also varicocele, men getting varicocele also is common with the weightlifting people. So that we should be very careful that when you are lifting the weight, you should see that you are expiring also. So don't hold the breath for a long time. It will increase the intrathoracic and venous pressure in the lower extremities. Next, what are the other diseases which can associate it with this venous problems? Comorbidities, what are the? Usually, according to the modern concepts, it is my understanding, it is an autoimmune disease. The other autoimmune diseases like arthritis, including the osteoarthritis and the thyroiditis, it's very common with this type of people. And it is usually obesity and metabolic syndrome, hypertension, diabetes, dyslipidemia, and it's attached to problems like heart disease, heart attack. It's also very common with this varicose vein patients or this venous problem patients. Next, what are the complications which can occur with this type of venous diseases? One is for the varicose vein and the piles. It is the bleeding is the most one of the reason, but one of the complication. But initially, it will not be the after only the progression, it will bleeding occur. Initially, there will be discoloration of the leg and the restless leg syndrome, and it is associated with disturbing the sleep and insomnia. Then arthritis and skin itching and some skin lesions. Then it goes into non-healing ulcers or a sudden bout of bleeding from a dilated vessel, and those are the complications usually occur. Next, what are the investigations in such a patient? What type of tests we have to do? For the diagnosis, we can examination and the Doppler study, the blood flow assessment, and we can find out what are the problem. Or if it is a piles, we can look into an endoscopy. But to find out what is the reason and how can we correct it, we have to make a detailed investigation, testing like nutritional deficiencies, toxins levels in the body, and what are the food which is creating problem for the patient, for that food intolerance and allergies, and also this inhalant allergy, contact allergies. Those things also can be looked into to see how much his body is reacting to such food items. And then what are the problems which the investigation has to be done to see what are the damages this comorbidities has produced on the liver, kidney, and heart and the vital organs. And the immune system or the hormonal damages, all these things we can assess. And the amount of organ damage also we have to assess before definitely starting for it, to get a better idea about the patient and how can we get corrected. Next, we will see what are the treatment options with this venous diseases. First, this varicose vein or the piles or the varicocele, everything comes under the lifestyle disease. So, first line of management is correcting the lifestyle. Take your eating habits, correct the eating habits, do the exercise. And next level, you can also, for immediate relief, you can elevate the leg. If you have dilated veins and if you are paining the leg for after long standing, you can raise the leg for a short time, 10, 15 or 30 minutes, and not just a small amount. If it is possible, like raise the legs around 50 to 70 degrees, 70 degrees, so that the flow will be fast and the leg will get comfortable. And even 10 minutes will be sufficient. By the time the patient will feel much comfortable. Next is compression stockings. That is also very commonly used. Next, most important thing is if it is a person is obese, and especially abdominal obesity, is the weight loss. Control calorie, do exercise, and reduce the weight. This is the most important thing which can give fast result also. Next, when we come to the medical treatment, there is not much medicines for this condition. Only if there is a pain, we can take painkiller, or if there is a blood clotting, or you can take blood thinners or something like that. The major thing which is used for this particular varicose vein or piles is flavonoids, diosmin or hesperidin. These capsules or tablets are available. That will give some comfort will be there, but it will not cure the disease or not give much benefits. But it will be, if it is an increased situation, if it is taken, some relief will be there. The mainstay of treatment in the modern medicine is the surgical treatment. The first line of initial treatment was stripping and removing the superficial veins. Actually, it is not the superficial vein alone is affected. It is the deep vein. The major blood flow is happening during the deep veins. Actually, what we are seeing is superficial veins which is getting dilated, but equally or more damage is happening inside also. Main aspect of treatment for this varicose veins or varicocele and piles and all in modern medicine is surgical treatment. In that, actually, what we are doing is reducing the either removing the blood vessel or tying the blood vessel to reduce the flow or the blood flow itself, or injecting some chemicals into the blood vessels to make it strengthen, or even this sclerotherapy is one form of this injecting the chemical, or using lasers or radio frequency energy, which is or ultrasound or even steam, which is inserted into the blood vessel, this vein, and making it get compressed or damaged, so that it will stick together and the blood will not flow into that. When the superficial blood vessels is shrunken, definitely there is a problem. The skin blood has to remove all the toxin, and that is the reason, because the blood flow is affected because of all these surgeries. That is the reason after some time these problems recur. So the benefit is, because of the surgery, benefit is only the cosmetic benefits is there definitely, and also the temporary benefit for the symptoms. But functionally, it is only a negative impact, because your blood vessel which is developed during your intrauterine life itself, so you are removing that. So that is actually a problem, and that is the reason for whatever you do, the recurrence happens also. Okay, now we have seen what are the reasons and what are the treatment options which is currently available. And we know that there is no much effective treatment for this varicose vein, or only this removal. Actually, it is destroying the part which is affected. So what is the real solution for this? Basically, early diagnosis. When for the varicose veins, you can find out when it is very small itself, spider veins appear in the thighs and leg and all. So that stage itself, we should understand that the problem is coming, or discomfort, okay, or if you have a restless leg syndrome, or repeated cramps, or without any reason, muscle cramps, if it is occurring, sometimes it may not be the superficial blood vessels alone, the deep vessels may be damaged. Especially those who are very obese, the superficial vessels may not show this kinking and the dilatation and all. So we may have to do a Doppler study and see whether there is any problem like this these valves are affected, or what is the condition of the blood vessels. And if there is a problem, then what is the next, this real and the most effective solution is, if it is, and especially when it is diagnosed in early stage, lifestyle moderation is the lifestyle correction. If the person is overweight, reduce the weight, come to normal BMI. It is, if you are having a varicose vein, everyone thinks that the 25, the Westerners think that generally taken as it is 25 is okay. That is the upper limit. You should understand that. For Indians, we consider it's 23 is the maximum BMI. It is not the ideal. Ideal for a person with varicose, any disease, especially with varicose, any lifestyle disease, or especially with this varicose veins, it is always go to the low normal BMI. That is, for the Indians, 18 into 23 is normal. Go to 23 or 18 or 20. Not keep it as the ideal is not 23 for a patient actually. And even Westerners, this Caucasians and all, they consider is 25 is okay, but there is an upper limit, and there also you have to come down to around 18.5, 19, 20 will be the most comfortable for you. And it also depends on what is the amount of fat inside the body. Whatever is the weight, the fat content will be around, for the men it should be around 10 to 15, and for the women it should be around 15 to 25. So if you can, so okay, whatever is the weight, especially if the bodybuilders and all maybe having excess weight, it will be high. But the thing is, fat level should be okay. That is, you should keep the fat level optimal level. Next is to avoid toxins. many of these chemicals, especially food additives, colors and preservatives, and even the cosmetics applying on the body, it is actually adding on the toxin level in the body, and it is actually prevent the healing power, and the autoimmune disease and the immune problems can occur because of that. And you should also find out the intolerant food. Actually, to find out the intolerant food, it is very easy if you have piles. Because we know that everyone knows that it is certain food will be producing bleeding or anal pain and discomforts. But it will not be very evident for the varicose vein or the varicocele. But if along with that, if you are having, even though you are a person who is having varicocele or varicose vein, and there is discomfort after taking some food at the anal area, that means that food is not suited for you. And that is the reason why actually without any reason sudden burst of bleeding comes for the varicose vein. That is because of this. It is not just without any reason. The some food which you have taken has increased the venous pressure or make another thrust for the blood vessels. That is the reason for the sudden bleeding and all. So we should be careful about your eating and the food items itself. Next, you have done all measures to reduce the weight and come out of varicose problems and ulceration, etc. But you're not able to come out of the problems with your own weight, lifestyle correction. Then definitely you have to think of a clinically supported lifestyle correction. In clinically supported lifestyle correction, there will be special guidance and how much you can eat, and there will be support also will be there. If especially those who are taking other medicines for diabetes, hypertension, etc., they won't be able to do the lifestyle correction and come out of the disease by self. In such patients, definitely a clinically supported lifestyle correction will help. In short, first, the primary reason behind varicose veins, piles, varicocele, etc., is the damage and inflammation in the walls and valves of the veins that are responsible for returning blood to the heart after collecting metabolic waste. We should understand that this condition is present in all blood vessels in the body, and blood pooling as a result of gravitational forces is most visibly evident in the legs, anus and scrotum. Second, the current focus of modern medicine is surgery and procedures to shrink or remove the blood vessels to reduce the discomfort associated with the stagnation in blood circulation. Destroying blood vessels as a part of treatment can cause undesirable side effects. When veins are removed or lasers or procedures are used to reduce the enlarged vein, the flow of blood can be compromised. This is the reason why, in spite of treatment with sclerotherapy, laser surgery, glue therapy, stripping, etc., very often the discomforts, enlargement, ulcers, and bleeding develop again. Third, modern day studies shows that the increase of the amino acid homocysteine damages the blood vessels and not only cause varicose ulcers but also increases fat deposits in the blood vessels leading to heart attack and stroke. The primary reason for increase in the homocysteine is the change in the protein metabolism as a result of lack of nutrients like folic acid, vitamin B6, B12, etc. Fourth, when it is possible to identify and correct the anomalies in lifestyle that are damaging the blood vessels, it is possible to prevent further damage and to even possibly repair the blood vessels and get relief from the discomforts associated with this condition. Next, let us understand what is clinically supported and supervised lifestyle correction. In this, the first step is to understand your body parameters by assessing body composition, the lean mass fat mass ratio, body age, fat status, etc. Second step is to evaluate the current status of your organs like heart, blood vessels, liver, kidney, pancreas, hormones, immune system, toxin level, nutritional status, etc. And also to find out the most suitable food for your body and what to avoid. Third step is to identify that lifestyle modulation can help achieve a reversal of disease process, attain desired body composition, and normalize blood parameters. Based on the patient parameters, effort is directed to provide optimal nutrition, physical activity, and reduce toxin level. The focus is to create an enabling environment to balance the metabolic activities at cellular level. In most patients, even those on medication for many years or advised surgery for lifestyle diseases like diabetes, hypertension, heart disease, arthritis, autoimmune diseases, cancer, allergies, etc., can prevent progression of the disease to some extent, reverse the damages, and come out of most of the medications within a month and avoid surgeries, provided the patient is able to correct lifestyle before the organs are irreversibly damaged. Now let us see what a patient can expect from clinically supported lifestyle correction for the person is suffering from varicose veins. This is a 60-year-old lady, height 160 centimeters and weight 65 kg. And she's suffering from, according to her, she's suffering from varicose veins for the last 15 years and she finds it very difficult to walk. And there is thickening of the skin at the sole of the feet also. Callus formation is there. And even she is not able to do the regular activities, and the blood on examination the blood vessels are very much tortuous and dilated, and itching and skin lesions are also there. Swelling, edema also is there on both legs and with the discoloration, and pain below the feet, that is actually most horrible. The patient is having most difficulty with this sole pain, and the left leg is affected more, and the muscle cramps also is there. And when we looked into the investigation, her vitamin D is very low, and also the folic acid level is very low, and this anti-TPO, that is an autoimmune antibody, is positive, and AMA also, 2 autoimmune antibodies are autoimmune markers also high, ESR is high, and also the hsCRP and homocysteine level also is high, that is vascular markers. And then when into the allergy and intolerance test about, she's having allergy to milk, egg, and so many food items. The regular food items also, many of the, even potatoes, she's allergic. So this even when we look into her leg, actually she's having deformity of the toes. That is actually typical of this rheumatoid arthritis patient. There's so much of deviation is there. That is the reason actually giving her this thickening of the callus formation at the sole and giving her pain. With the lifestyle correction, what we are aiming is to give optimal nutrition, correct the nutrition, and increase the circulation, even though she doesn't have, not able to walk. Most of these patients, they will not be able to do exercise like walking or running or anything like that. So floor exercises are, and with lying down on a bed itself, they can do the exercises and give all the nutrition in the correct proportion and reduce on calories so that she can reduce the weight. For this patient, because of this callus formation and deformity of this foot, she should reduce her weight to the low normal. Actually, for a 160 centimeter height patient, now she is 5 kg, 5 maximum weight for an Indian, what she can have maximum is 58, 59. But now she is 65. To reduce it to low normal, that is maximum means it is around 23 per BMI. It is ideal for her to around 18 or 18.90. So what we are trying to do in this, to reduce her weight to initially below 60 and then around to bring it to around 50. And her fat percentage also was very high. Her fat percentage was around 39.3. So for a lady, it is always better to be around 25% fat. 15 to 25%. So during the course of the treatment, actually she was able to bring down her weight to 65 to 61 in the first 1 month itself. And her fat level, she was able to reduce from 39.3 to 37.9. So fat also reduced, even the tummy fat is reduced. And within actually in the 8th day, usually the patient visit on the 8th and 15th day and then 30th day. By the 8th day itself, she has much relief, and by the 30th day, the pain, muscle cramps, everything is gone. The problem was persisting was with the sole thickening and the callus formation. That is actually creating problem for her. And even this autoimmune antibodies has started coming down, and it was AMA has come down to, by 90 days, it has come down to 27. It is not corrected fully. So for the autoimmune disease, it is very difficult to autoimmune antibodies to come down to normal. But the symptomatic relief is very fast with the lifestyle correction. And even this, when they avoid this trouble producing food items, etc., the body can actually, this result is because of the body is actually changing every day or every minute. And within 90 days, almost 90% of the cells in the body is changed. So during this 90 days, if you are taking good food, and good food means the nutrition in the correct proportion, and if there is a excess fat in the body, low calorie, then you will be able to get out of weight reduction, and also it can provide this repair and rebuilding of the cells and the organs. That is the reason this fast result. Actually, almost this immune system cells are actually turnover is only 7 days. That is why within 7 days, 8th day when the patient comes, they will be comfortable, because the blood vessel linings and even the intestinal linings, respiratory linings, etc., will be replaced by the time itself. And even the internal lining of the venous, this thing is already changed. So with the good nutrition, this new cells is lining the blood vessels, so the damage is, the symptoms is reduced. But it will take this dilatation of the blood vessels to reduce it. That will take time, because it is made of collagen, elastin and fibroblast and all is there. So those takes time for repair and rebuilding. It will take more time. This patient, actually, she was able to, by the 30th day, she is able to come down to weight 555. So this burden on her leg is reduced, and her intrathoracic and intra-abdominal pressure is reduced. That is actually giving her comfort. And by the 180 days, actually, it is continued for usually 6 months. Initially 90 days, food support will be given. Then the food support and all is reduced. And by the 60th day, she was able to bring down her weight to 51 kg. We want to bring down, keep her weight around 50 kg actually. And her fat level also, abdominal fat, it was initially it was 8.5. This came down to 3%. And the total body fat was around 39.3, and it came down to 29.2. So the patient is totally comfortable. Only the symptoms is because of this deformity on the leg actually. Otherwise, that if a deformity is that some repair will be possible, even the joint deformity and all. But complete repair, it may be possible, but it may take a long time. Only thing, the patient should take the optimal nutrition and exercise and all in the correct way for a long time for getting more and more result. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of the toxin by improving circulation through optimal stimulation of the cells by planned exercise. Third, minimizing toxin entering the body through food, water, air and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune disease, etc. comes under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgery are for lifestyle diseases. This means that 90% of the medication and 90% of the surgeries can be avoided. It is good to understand that neither medicine nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication, no surgery that created the disease. This is why once medication is started, very often both the disease and medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment as approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam in 1981 and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service. Later resigned from the government service and in 1997 started practicing as consultant at Lifecare Center, Tevara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease and come out of medications to protect our children, grandchildren and coming generation from the ill effect of toxic pharmaceutical pollution. We should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends and colleagues who are on chronic medication or planning surgery for lifestyle disease. The last few decades of modern medical management clearly shows that medication and surgery cannot cure most lifestyle diseases. Reliable and sustainable solution lies in lifestyle modulation. To know more about different lifestyle diseases, treatment options, a reversal of lifestyle disease with the clinically supported lifestyle correction, etc., you may visit our YouTube healthcare channel. Thank you.